What is fatty liver disease? Fatty liver disease means you have extra fat in your liver. You might hear your doctor call it hepatic steatosis. Most of the time, it doesn't cause symptoms, but over time a buildup of fat makes it harder for your liver to work. With diet and exercise, fatty liver disease can be reversed. Fatty liver disease types. There are two main types of FLD. 1. Metabolic dysfunction-associated steatotic liver disease. This type used to be called non-alcoholic fatty liver disease. It is very common in the US, affecting 1 in 3 adults. Researchers aren't exactly sure what causes it, but having obesity or metabolic disorders such as insulin resistance, dyslipidemia, central obesity, and hypertension will increase your risk of getting it. Unlike the other main type, you don't get it from drinking alcohol. There are 2 forms of MASLD. Simple fatty liver. This means you have fat in your liver, but you may not have any inflammation in your liver or damage to your liver cells. It usually doesn't get worse or cause problems with your liver. Most people with MASLD have simple fatty liver. Metabolic dysfunction-associated steatohepatitis. This used to be known as non-alcoholic steatohepatitis. It's the advanced stage of FLD and means you have inflammation in your liver. The inflammation and liver cell damage that happen with MASH can cause serious problems such as hepatic fibrosis and lead to cirrhosis, which are types of liver scarring, and liver cancer. These problems can lead to liver failure and require a liver transplant. NASH-related cirrhosis is already the leading indication for liver transplantation in women and those over 65 years of age. About 20% of people with MASLD have MASH. 2. Alcohol-related fatty liver disease. This type is less common, affecting about 5% of people living in the US, and is caused by drinking alcohol. For this reason, it usually gets better if you stop drinking alcohol soon enough. If you keep drinking, ALD can cause serious problems that progress in stages: enlarged liver. It doesn't always cause symptoms, but you may have pain or discomfort on the upper right side of your belly. Alcoholic hepatitis. This is swelling in the liver that can cause fever, nausea, vomiting, belly pain, and jaundice. Alcoholic cirrhosis. This is a buildup of scar tissue that stops the liver from functioning normally. It can cause the same symptoms as alcoholic hepatitis, plus large amounts of fluid buildup in your belly, high blood pressure in the liver, bleeding in your body, confusion and changes in behavior, enlarged spleen, liver failure, which can be fatal. Alcohol-related fatty liver disease usually comes first. It can then get worse and become alcoholic hepatitis. Over time, it may turn into alcoholic cirrhosis. If you drink heavily, talk with your doctor. It's confidential, and they can help you get your drinking under control to save your health. Fatty liver disease symptoms. With ALD and MASLD, there are usually no symptoms. Some people may have signs such as tiredness or pain in the upper right side of the belly where your liver is. If you have MASH or get cirrhosis, you may have symptoms such as swollen belly, enlarged blood vessels underneath your skin, larger than normal breasts in men, red palms, skin and eyes that appear yellowish due to a condition called jaundice, nausea, weight loss or loss of appetite, tiredness or mental confusion, abnormal liver function tests. Fatty liver disease risk factors. For ALD, the cause is too much alcohol. You may be even more likely to get it if you drink a lot and have obesity, are malnourished, have chronic viral hepatitis, especially hepatitis C, or Black or Hispanic and male or assigned male at birth, are female or assigned female at birth because of the way the bodies of these individuals process alcohol, are older. The older you are, the more likely it becomes. The reason why some people with MASLD have simple fatty liver and others get MASH isn't known. Genes, other existing medical conditions, and environmental factors may be a reason. MASLD or MASH is more likely if you have obesity or overweight. Your body doesn't respond to insulin as it should, or if you have type 2 diabetes. You have high levels of triglycerides or bad cholesterol, or low levels of good cholesterol. Chronic kidney disease. You're older. You have polycystic ovary syndrome. You have sleep apnea. You have an underactive thyroid. You have hypogonadism or growth hormone deficiency. You're malnourished. You've lost weight rapidly. You've been exposed to certain toxins and chemicals. You're Hispanic or Asian. You have metabolic syndrome. This is a mix of conditions that make you more likely to get type 2 diabetes and heart disease. With metabolic syndrome, you may have any three of these conditions. Large waist size, high triglycerides or LDL cholesterol, low levels of HDL cholesterol, high blood pressure, high blood sugar. There are also some less common reasons why you may get MASLD or MASH. They include medical conditions that affect how your body uses or stores fat, hepatitis C or other infections, fast weight loss, taking certain medicines such as glucocorticoids, methotrexate, synthetic estrogen, tamoxifen, and others. Gallbladder removal. Some people who have surgery to remove their gallbladder are more likely to have MASLD. Fatty liver disease in children. About 10% of children in the US have MASLD, and numbers are growing as the number of kids who have obesity grows. MASLD is also more common in older children rather than younger children. Hispanic and Asian American children rather than white and black children. Boys rather than girls. But most children with MASLD don't get liver problems, and MASLD can be controlled or reversed if your child becomes more active, loses excess weight, and has an improvement in their eating habits and nutrition. Fatty liver disease diagnosis. Because most people don't have symptoms, these conditions aren't easy to diagnose. Your doctor may use different methods to find out if you have fatty liver disease. Some of the things your doctor may use to diagnose fatty liver disease are health history and physical exam. Your doctor will ask about your alcohol use. This information can help your doctor tell if you have ALD or MASLD, so be truthful. They'll also ask about medications you take, how you eat, and other health conditions you might have. Your doctor will also check your body for signs of liver problems such as a firm liver or jaundice. Check your height and weight to calculate your body mass index. Your BMI determines how much you should weigh based on your height. They may look for signs of insulin resistance. Blood tests. Your doctor may order the following blood tests: liver function and liver tests to detect and monitor liver disease and damage. The cells in your liver have proteins called enzymes. When these cells are damaged, the enzymes leak into your bloodstream, where they can be measured. If your liver is damaged, the level of these enzymes will be higher than normal. Fibrosis assessment tests, also known as FIB-4, to estimate your level of liver scarring. These blood tests result in an indirect score that estimates your level of liver scarring. Other blood tests show more direct markers of fibrosis. Lipid profile to measure blood fats, such as cholesterol and triglycerides. Other blood tests to rule out other causes of FLD, like tests for hepatitis C and Wilson disease. Hemoglobin A1C, which shows how stable your blood sugar is. Imaging tests. You may get an ultrasound, computerized tomography scans, or magnetic resonance imaging. These tests can show if there's any fat in your liver, but they can't tell whether you have simple fatty liver or MASH. There are some tests that can show whether you have fibrosis by measuring the stiffness of your liver. When liver cells die, they're replaced by scar tissue, which is stiff. The stiffer your liver is, the more scarring it has. Transient elastography measures liver stiffness using a special ultrasound machine. Magnetic resonance elastography combines ultrasound vibration frequency and MRI to create a visual map of stiffness throughout your liver. Liver biopsy. Not everyone with MASLD needs to have a liver biopsy. Your doctor may recommend it if you're at risk for MASH or if other tests show that you may have MASH complications such as cirrhosis. It is considered the gold standard for diagnosing and assessing liver fibrosis. A doctor removes a sample of tissue from your liver and sends it to a lab to see if you have liver inflammation or damage. You'll get this done at a hospital or outpatient surgery center. Before the procedure, you'll get medicine to help you relax or control pain. For the biopsy, your doctor numbs the area and uses a special needle to take a small piece of tissue from your liver. A liver biopsy is the only way for doctors to diagnose MASH. Fatty liver disease treatment. Usually the first line of treatment is to lose excess weight. It helps reduce fat, inflammation, and scarring in your liver. Losing just 3% to 5% of your body weight can cut down on how much fat is in your liver. Weight loss surgery is also an option if you do not achieve the weight loss goal after lifestyle interventions. One drug, Remedirome, has been approved to treat MASH. You use it as part of a treatment plan that includes exercise and a healthy diet to lose weight. And whether you have MASLD or ALD, you'll also need to not drink alcohol. You may be able to undo some of the liver damage that's already happened. If you need to, talk to your doctor about how you can get help. You may need a medically supervised detox program to safely quit drinking and manage withdrawal symptoms. If you have complications due to either type of FLD, such as cirrhosis or liver failure, you may need to have a liver transplant. In general, people with MASH who get a liver transplant do very well. Fatty liver disease alternative treatments. Vitamin E studies have shown that vitamin E could improve liver health by reducing inflammation, but the results varied depending on the dosage, patient's age, and how overweight they were. Also, some studies showed that high doses of vitamin E could be dangerous for people with other medical conditions as well as FLD. Coffee. Caffeinated coffee has long been thought to be good for the liver and linked to slowing down liver scarring in various liver diseases. It's not clear how coffee prevents liver damage. One theory is that coffee activates enzymes that detoxify the liver. Another is that coffee has compounds that lower inflammation. Olive oil. As a healthy fat, olive oil lowers the amount of fat stored in your liver, improves how your body deals with fats and sugars after a meal, and reduces inflammation. All of these methods are still being studied, so talk to your doctor or nutritionist before deciding to drink extra coffee daily or take extra olive oil or vitamin E. Reversing fatty liver disease. FLD can be reversed if you avoid alcohol and take steps to get to a healthy weight. The liver is one of the few organs in your body that can replace damaged tissue with new cells rather than with scar tissue. But that reversal only works if you don't drink alcohol and follow a healthy lifestyle. Fatty liver disease self-care. Lifestyle changes can help. Exercise more. Try to be active at least 30 minutes a day most days of the week. If you're trying to lose weight, you might find that it helps to exercise more than this. But if you don't already exercise regularly, get your doctor's okay first and start slowly. Be kind to your liver. Don't do things that will make it work harder. Skip alcohol. Take medications and over-the-counter drugs only as instructed. Talk to your doctor before you try any herbal remedies. Just because a product is natural, that doesn't mean it's safe. Get your cholesterol down. Eat a healthy plant-based diet, exercise, and take your medications. This will get, and keep, your cholesterol and your triglyceride levels where they need to be. Manage your diabetes. Check your blood sugar and take medications as your doctor prescribes. Fatty liver disease diet. Changing the way you eat can help to lessen or reverse MASLD or MASH. You should try to limit foods that are high in fats. Replace saturated fats with unsaturated fats. Eat foods with a low glycemic index, such as fruits, vegetables, and whole grains. Avoid foods and drinks with a lot of simple sugars. Follow a Mediterranean diet. Fatty liver disease complications. The main complications for all these conditions are cirrhosis and an increased risk of liver cancer. As your liver tries to stop the inflammation that comes with these conditions, it creates areas of scars. As inflammation spreads, so do the scars, and eventually, your liver can't do its job. That can result in fluid buildup in your belly, swollen veins in your esophagus that can burst and bleed, confusion and drowsiness, an overactive spleen, liver cancer, liver failure. Life expectancy with fatty liver disease. If your liver has little or moderate scarring, it shouldn't affect your lifespan. But if you have cirrhosis, it could affect how long you live. If cirrhosis is diagnosed early, you could live another 10 to 15 years. If it is diagnosed late or you have complications, like swelling or fluid in your belly or bleeding in the gut, your life expectancy could be 3 to 5 years unless you get a liver transplant. Can you prevent fatty liver disease? To prevent ALD, drink in moderation. That's 1 drink a day for men over 65 and women of all ages, and up to 2 drinks for men 65 and younger. Protect yourself from hepatitis C. This viral liver infection can make you more likely to get cirrhosis if you drink. Check before you mix meds and alcohol. Ask your doctor if it's okay to drink alcohol with the prescription medications you're taking. Read the warning label on over-the-counter meds. Don't drink when you're taking products like acetaminophen, which can damage your liver when combined with alcohol. For MASLD and MASH, it boils down to making good choices. Eat healthy food. Choose a plant-based diet with lots of fruits, vegetables, whole grains, and healthy fats. Stay at a healthy weight. Lose weight if you need to. If your weight is healthy, work to maintain it by choosing a healthy diet and exercising. Exercise. Get a workout most days of the week. Talk to your doctor first if you haven't been active in a while. Takeaways. Fatty liver disease means you have a buildup of fat in your liver. One type of this condition is due to drinking alcohol. The other type, which is more common, doesn't have a specific cause, but things like having obesity and diabetes can increase your risk of getting it. Fortunately, you can reduce or even reverse liver damage by making lifestyle changes, like eating better and getting more exercise. With both types, you should not drink alcohol. FAQs. Is fatty liver a serious problem? Not for most people. But for 7% to 30% of the people with fatty liver disease, it will get worse if it is not treated.